One of my favorite treatment modalities is platelet-rich plasma, PRP. It is a natural way for us to approach tissue repair, regeneration, and healing. We can apply it not just in aesthetics, but also in hair restoration, orthopedics, sports medicine, and wound care. It is used across the board to allow for us to treat patients with high yield and low risk. Platelet-rich plasma is derived from a patient's own blood. We do a blood draw, we spin it in a special centrifuge, and from that centrifuge, we get a concentration of platelets. Those platelets are then injected to the part of the body that we are trying to treat. PRP can be utilized for many different indications, but to appropriately get the right PRP treatment, you have to make sure that you're utilizing the appropriate PRP centrifuge. You see, if you take someone's blood and you spin it in a regular centrifuge, you may not get the appropriate amount of platelet concentrations in that sample. In order to derive optimal results, you need to get 5 to 7 times the concentration of the average patient's platelets in that sample. And in order to do that, you need an appropriate centrifuge that is likely a 2-spin centrifuge with a G-force of 200 to 400 that has tubes that are anticoagulated that can then produce the sample that you need. If you're using the PRP for orthopedics or wound healing, then you're going to need essentially a sample of PRP that is leukocyte rich, because some of that inflammation is going to be beneficial for you. If you're using it for aesthetic use, then you need PRP concentration that will be leukocyte poor, because you don't want that excess inflammation. So making sure that you as a provider have the appropriate centrifuge in order to attain the right amount of PRP is essential for appropriate treatment. Too little PRP in the sample is not going to benefit in any way. Too much PRP in the sample may actually have a paradoxical effect, and the excess inflammation may actually be damaging for the regenerative processes that we are looking for. So overall, PRP is generally moderately recommended in orthopedics and in wound healing as a treatment modality for patients, and is highly recommended both in aesthetics and in hair restoration. There is still copious research being done, and because of its high yield, low risk ratio, it is a beneficial treatment overall for our patients.